Hello and welcome to another edition of Health with Patricia, where we have honest conversations about issues affecting your health and well-being. And today we're discussing vaginal birth versus CS. When should we have a vaginal birth and when should CS come in? And my guest, Dr. Promise Sapoga, is here to educate us on it. Doc, yeah,
Yes, ma'am.
vaginal birth and CS. You know, mostly, I think, I don't know why we disturb women, because when you have natural birth, you are termed, oh, you've done well, like you've been able to push the baby out. But immediately CS comes in, there is this perception about you, like you are lazy, you don't want to push your baby out, and you have to go. When is it right for a woman to have a vaginal birth, and when does CS come in?
So, thank you. It's an important question. But the truth is, every woman wishes they could have birth vaginally.
Yeah.
And that is also the wish of us, all care providers. Because cesarean is more work, it is surgery, it could have complications, right?
Okay.
But the social or our cultural perceptions make it seem as though if you deliver through cesarean, like you said, it has a stigma. But there's absolutely nothing wrong with that, because there is a reason why the person needed a cesarean.
Okay.
Yeah, it is not. Yes, granted, these days we have the option to opt for the cesarean section, even in the absence of medical reason. Fair enough, you have a right to your body. But that cultural aspect where we think that if the woman did not give birth vaginally, she's lazy or she's not a full woman, is just outmoded, right? Now, vaginal delivery is what we anticipate for every pregnant woman.
Yeah.
But it just so happened that one thing or the other would make it impossible or extremely risky for some people to attempt to have vaginal delivery. Now, the reasons why vaginal delivery may not be safe could be due to issues with the fetus.
Okay.
Or the baby, or issues with the mother, or issues with both of them. Okay. Now, when you take the issues of the mother, for instance, some women, the hip bones are such that the passageway for the baby to come is too narrow.
I think one gynae told me that some time ago. I wasn't pregnant. Immediately he saw me and said, never try a vaginal birth. You always have to go for CS. I'm like, oh, wow. I said, no, you're too...
Right. So that is just because the hip, as we have it, there are 4 main hip types.
Okay.
Okay, so every woman will belong to either one or the other or the other or the other. And some of them just make it difficult. If you attempt, the baby gets stuck, you have to still end up at an emergency cesarean section.
Okay.
Right. And that is not the woman's fault. She was born like that. Just like somebody is born short, somebody is born tall, somebody is born fair, somebody is born... It's just the nature of how she came into the world. And it goes with it. Right. So that is one of the common reasons why somebody may not be able to have vaginal delivery.
Okay.
Other times, the woman has a problem with the womb.
Okay.
Okay. For instance, somebody has fibroid that are in the lower part of the womb where the baby would pass. So there's no way the baby can come. You know how fibroids are common in this part of the world. If you take 100 women on the street, 70 of them have fibroids. But not everybody even knows they have fibroid, which is okay, right? Some people will only get to know they have fibroids when they are pregnant, and we do the scanner with, you have fibroid, you have 1, 2, 3 fibroids. Or there's a bigger one in the lower part of the womb. So attempting to deliver vaginally may not be safe for you.
Okay.
You see what I mean? Sometimes what we call the placenta, instead of implanting at the upper part of the womb, the placenta could choose to implant here. This is where the baby will pass through to come. If the placenta is covering here, there's no way the baby can come. And that is not something the woman has chosen. She didn't hold the placenta and put it there. Okay. We call it placenta previa. When that happens, our best bet is to have you deliver vaginally. Then we remove the placenta. And when the placenta is at that position, it also tends to cause a lot of bleeding after delivery.
Okay.
So then when we do cesarean, then we remove the placenta, then we take time and stop all the bleeding.
Okay.
Because we can see, right? Those are some of the problems pertaining the woman. Sometimes the woman has had fibroid and underwent surgery to remove the fibroids, okay? Because of that, the womb has become, so when we cut the womb to remove fibroids and we stitch, wherever we stitch, that becomes a scar. And those scars are like weak points on the womb. If you put that womb to go through contractions of labor, they can all readily, easily tear. That's what we call uterine rupture. So the womb is torn. The woman is bleeding inside. The baby gets thrown out of the womb. The woman can easily die.
So this is what also causes like maternal mortality.
Absolutely.
Because at the end of the day, they are not able to immediately...
Yes, get access to. Because when that happens, you need to be rushed to theater immediately, get into surgery, look for lots of blood because you're losing blood. Every human being adult has just about 6 liters of blood in them. 6 liters.
Okay.
That's all we have. So if whatever happens and you bleed so much within a short time, you bleed out all your blood, you need blood, and we don't have ready access to a lot of blood to replace when people are losing blood. Okay, so when we foresee these things, we say, you know, it is safer for us to do a planned cesarean section to forestall all these things. How is that a woman's fault?
It's not her fault.
It's not her fault. Okay. Then sometimes the woman is advanced in age.
Okay.
And then she struggled to conceive. Maybe we have to do IVF before she got this pregnancy. The woman is already 52, 53, 54, 56 years old. We've helped her to conceive. So we just want to play it safe by going in to deliver that baby through cesarean section without risking labor, because we are afraid that maybe she goes into labor and the baby is not able to withstand the stress of contractions, and then we lose that baby in the course of labor. Okay, so women of advanced age or women who have undergone through some fertility assistance before they conceive, we consider it more safe, a safer option to deliver through cesarean section. Now, if a woman has delivered through cesarean section once,
Yeah.
and the reason why she had a cesarean section is not something that can recur, then she stands a risk of being able to deliver vaginally afterwards.
Okay.
Maybe take, for instance, the pelvis was okay, but when she was in labor, we realized the baby's heart rate was dropping.
Okay.
It means that baby cannot withstand labor. So quickly, we do cesarean section to save the baby.
Oh, okay.
Right? When this woman gets pregnant again, it does not mean automatically she must have cesarean section. Do you get it?
Yeah.
So, but if a woman has had cesarean section 2 times and above, then it is no longer safe to attempt to have vaginal delivery.
Okay, sure.
Again, because the scar becomes weaker and there's a risk that the uterus can tear in the course of attempting to deliver vaginally. Okay. So these are some of the reasons on the part of the mother. Now, some of the time it is due to conditions pertaining to the baby. For example, if the baby is too big, now we expect that at the time of delivery, all the baby's weight should fall between 2.5 kilos up to 4 kilos.
Okay.
That's a normal birth weight. So if for one reason or the other, the baby, we do the scan and we see that the size is bigger than that 4 kilos, chances are that attempting to deliver vaginally could cause the head could come all right, but the shoulders are stuck and the baby is stuck. If you're unable to do maneuvers to quickly deliver the baby, we easily lose those babies. So if we check and the baby's size is too big, then we say it is safer to deliver this baby through cesarean section. Right?
Okay.
Sometimes we check and the baby's size is way too small, smaller than the 2.5.
Okay.
It means that baby is not very, very strong to go through the stress of labor. Because during labor, the womb contracts,
Okay.
then relaxes, contracts. That's what causes the pain, and you'll be screaming. Now, each time it contracts, it momentarily cuts off blood flow to the baby.
Okay.
Then when it relaxes, blood flows to the baby again, contracts again. So not every baby is able to withstand that short moment of cutting off blood flow.
Okay.
So there are some babies that when this is going on, their heart rate will be dropping. It means that baby cannot withstand labor. If you don't quickly stop the labor and go do cesarean section, the baby will
die.
be lost. Yes. It comes as a fresh stillbirth. So if the baby also is very small, we play it safe by saying, let's do cesarean section. Or the woman has very high blood pressure, what we call gestational hypertension or preeclampsia, where she's about to have a convulsion. You don't have time to say, let me now start her to go through labor for another 7 to 10 hours. The worst could happen. And in some of those situations, the best is, which is the fastest way to deliver the baby.
Okay.
And end the woman's suffering. Sometimes the baby's position is not normal. We expect that, yes, we expect that normally the baby's head should be facing down and the legs are up.
Yeah.
Okay, so the baby is coming with the head leading the way. But nobody's in the womb to talk to the baby that, hey, baby, turn this way, no. So baby decides to come lying across the womb like this, or lying diagonally, what we call oblique, or transverse lie. Or baby decides to actually somersault so that the bottom is here, the head is here. Occasionally, the bottom is here and one leg is already leading the way.
Yeah.
There's no way that baby can come safely through the natural birth.
I think I've seen videos of where they try to hold the tummy and then shift the baby.
Yes, we do some of that. When the bottom is here and the head is here, and there's no evidence that the water is broken, we do some maneuver, we call it external cephalic version.
Okay.
We try to flip the baby so that bring the head down and bring the bottom up.
Okay.
Sometimes we succeed. Sometimes you don't succeed. Because sometimes accidentally whilst you're doing that, the placenta can peel off and then she starts bleeding. If you don't have ready access to theater, you're going to lose that baby. So it is something that we do sometimes, but with a calculated risk, so to say. It works in some cases, sometimes it doesn't work, and then we still have to go ahead and do cesarean section.
Wow.
Sometimes the baby has some abnormality. Some babies' heads are abnormally big due to one problem or the other, that it cannot come through the birth canal. Okay. And so it will necessitate a cesarean section.
Okay.
Sometimes the woman is pregnant. You're not supposed to bleed during pregnancy.
Okay.
One of the common things that cause bleeding is when the placenta is peeling off. The placenta is only supposed to peel off after the baby has been delivered. But sometimes a pregnant woman suffers something we call abruption. The placenta is peeling off. She's bleeding. If you don't quickly deliver, you're going to lose that baby. But
what causes that? Is it stress or maybe something that the woman has done or
Great question. Sometimes high blood pressure can cause that. The blood pressure shoots and the placenta abrupts. Sometimes trauma. When a pregnant woman slips and falls down, that's one of the things we fear. Sometimes some men who are, I don't know how to describe them, both wicked and senseless, beating pregnant women. That trauma can also cause that. Or a pregnant woman is involved in a road traffic accident. Some of these things can cause the placenta to separate. And when something like that happens, and we are lucky that the baby is still alive, quickly cesarean
you have to take the
to
baby
get
out.
the baby out.
Regardless of whether it's she's due or not.
No, we need to get a baby out because she's going to bleed all her blood and her life will be in danger.
I'm really glad we had this conversation, because it's not like you just decide, the doctor will just say, or maybe the woman will just decide that this is what I want.
Yeah.
It's basically what the doctor tells you.
Yes, what is safe.
What is safe for you.
In the interest of the baby and the mother. Like I said, These days, you have the option to say, I prefer cesarean section because of reason A, B, C, D. It's your body, you have a right to it. That's allowed. But majority of the time, we do it because of medical related reasons.
Okay, sure. In a case where a woman, maybe like her first pregnancy, she, as she said, it's narrow, the baby cannot come out. And then there was fibroids, there was high blood pressure, there was preeclampsia, all kinds of like diabetes and
Complications
all
in the
those
pregnancy.
complications. In the second pregnancy, is it likely to repeat itself? And then that means you have to do CS, or maybe, for instance, this I'm just asking two questions. So, for instance, she had fibroids, and then the fibroids, according to medical experts like yourself, you'll be like, oh, this particular fibroid, it's not blocking your fertility, but it's just going to make you have a baby with a retarded growth, like small baby. You're not going to have a big baby. And then she wants to take out those fibroids,
Yeah.
but not necessarily going through like the CS session, like cutting again to remove the fibroid, stitching, and now pregnancy comes, you have to go and cut again. Yeah, how?
I mean, yeah, when they are already pregnant, before we detect the fibroids, we monitor them. If at the time they are due, we judge that the fibroid would be in the way of vaginal delivery, then it's a cesarean section. After we've delivered the baby, we need to make a judgment. Can we remove this fibroid safely at the same time? If in your expertise, in your expert consideration, that can be done safely, we do that some of the time. If you think that the location of the fibroids or their sizes and their numbers would make the woman bleed too much, that would make it unsafe to do that at that time. We don't do it. We allow, finish the cesarean, let the pregnancy changes revert, then we plan and do the fibroid surgery before she conceives again.
Okay, sure.
Because when somebody is pregnant and they have fibroids, they go through a lot of pain.
Yeah.
The fibroids undergo something we call degeneration, which causes a lot of pain during the pregnancy. And also comes with some risk of the placenta positioning in the wrong place. Also comes with a bit of risk of, after delivering, bleeding excessively. And like you said, sometimes the fibroids are so many that it doesn't allow the baby enough room to develop fully. Yeah.
Wow. Thank you very much for this education. Please, your final words.
Yes. So if you're pregnant and it is time to deliver, and for one reason or the other, you are advised that cesarean is better for you and the baby, that is what it is. Sometimes, unfortunately, people go and they say, my pastor says no knife will touch this, your body. Meanwhile, there's a major risk to you attempting to deliver vaginally, and you avoid coming to have the cesarean, then complications happen. There is no sense in that. So, there is a reason why you'll be advised or counseled on the cesarean section. Nobody should stigmatize a woman because she's delivered through cesarean section. It's a sign of backwardness. Cesarean is a medical intervention which is offered when it is necessary. Thank you.
Thank you very much, Doc. So it's always advisable to listen to your doctor. Whatever he recommends is just to save your life and save your baby.
Yeah.
So please, women, let's not stigmatize our own selves. Like chinchana, it has to be vaginal delivery. Sometimes it's just CS that's best for you. Okay, so that's been it. I believe you have been educated. Don't forget to subscribe to Health with Patricia. Don't forget to share this particular video, and don't forget to follow. Until same time next week, stay blessed.